Have you ever found yourself in a moment of quiet reflection, perhaps catching a subtle scent that brings a pang of worry, a fleeting concern about how you're perceived by others? It's a feeling many of us encounter as the years accumulate, a silent question that surfaces. Are we truly embracing the fullness of life, or are there hidden aspects of aging that we're not quite prepared to address? This isn't about vanity. It's about dignity, comfort, and the profound desire to navigate our later years with confidence and grace. Before we dive deep into understanding why some older people might carry a particular scent, and more importantly, how to permanently address it, if you're looking for a community dedicated to embracing every stage of life with wisdom, joy, and practical strategies, make sure to hit that subscribe button right now on Aging Gracefully 60. We're here to guide you through the journey of aging, not just gracefully, but powerfully. Pain point/problem. One of the most pervasive, yet often unspoken, concerns that can subtly erode confidence as we age is the idea of developing a distinct old person smell. It's a concept that has permeated cultural consciousness, sometimes leading to self-consciousness and a feeling of being stigmatized. This isn't merely a matter of personal hygiene. It can delve into deeper psychological territory, creating a sense of isolation or a reluctance to engage fully in social situations. The feeling of worrying about how you might be perceived by others or whether a faint, undesirable odor is clinging to you can be incredibly distressing. It's a problem that often goes unaddressed because it feels too sensitive or embarrassing to discuss openly. The silent dread that you might be inadvertently emitting an unpleasant odor can lead to a withdrawal from social interactions, a constant hyper-awareness of your own body, and a significant impact on one's overall quality of life. This internal anxiety can be particularly acute when interacting with younger generations, amplifying the feeling of being othered or seen as less vibrant. Perhaps you felt this too, a creeping unease that subtly influences your daily choices, from how close you stand to someone in a conversation to the frequency with which you change your clothes. It's a reality many of us face, even if we don't articulate it aloud. The first and most crucial step in addressing the perception of an old person smell is to debunk the myth itself and understand its true origins. What is often attributed to a generic old people smell is, in many cases, related to specific identifiable factors, with urine odor being a primary, yet often misunderstood component. It's not an inevitable consequence of aging, but rather a symptom or a result of specific physiological changes and lifestyle habits. One of the most significant contributors is actually a compound called 2-nonenal. As we age, our skin's antioxidant defenses may decrease and our lipid composition changes, leading to an increased production of unsaturated fatty acids on the skin surface. When these fatty acids are broken down by oxidation, they produce 2-nonenal, which has a distinct, somewhat greasy or grassy odor. This is a natural, albeit sometimes noticeable, part of the aging process for some individuals, but it is rarely the overwhelming urine smell. The true source of a persistent urine odor is almost always related to urinary incontinence or inadequate hygiene practices surrounding it. Imagine the difference this understanding can make. It shifts the narrative from an unavoidable decline to a manageable challenge. To effectively manage and often eliminate the issue, a multi-pronged approach is necessary. First, for 2-nonenal, regular and thorough skin hygiene is paramount. This means daily bathing with a gentle pH balance cleanser, paying particular attention to areas where skin folds occur, such as the underarms, groin, and behind the ears, as these areas can trap oils and sweat. Using a mild exfoliating cloth can help to remove dead skin cells and prevent the buildup of oxidized lipids. Secondly, incorporating topical antioxidants, such as lotions or creams containing vitamin C or E, can help to combat the oxidative stress on the skin that leads to 2-nonenal production. Dietary changes, including increasing intake of antioxidant-rich foods like fruits and vegetables, can also contribute to overall skin health. For the specific concern of urine odor, the solution lies in addressing urinary incontinence directly and rigorously. This involves immediate and thorough cleaning after any leakage. Regular changes of absorbent pads or underwear are essential, and these items should be disposed of properly to prevent odors from lingering in the living environment. Consider how this might apply to your own life. Proactive measures can make a profound difference. Furthermore, maintaining good hydration is key, as concentrated urine can have a stronger odor. Consulting with a healthcare professional to explore treatments for incontinence, such as pelvic floor exercises, medication, or even surgical interventions, is vital. They can also rule out other potential causes of body odor, such as underlying medical conditions or medication side effects. The goal is to move beyond simply masking odors to addressing their root causes, which leads to a more permanent and empowering solution. Doesn't that resonate with you? It's a simple truth, isn't it? Pain point/problem. One of the most significant, yet often unacknowledged, contributors to a perceived urine smell in older individuals is the silent burden of undiagnosed or untreated urinary incontinence. This isn't just about occasional leaks. For many, it becomes a constant source of anxiety, embarrassment, and a pervasive feeling of losing control over one's own body. The very thought of an accidental leak can cause individuals to limit their social engagements, avoid public places, and even restrict their fluid intake, leading to other health issues. The continuous worry about odor and wetness can be mentally exhausting, impacting sleep, concentration, and overall emotional well-being. Imagine the profound impact this has on one's desire to participate in activities that once brought joy, from attending family gatherings to enjoying a leisurely walk in the park. The fear of being found out creates a self-imposed isolation, a quiet retreat from a world that once felt accessible and welcoming. This fear often stems from a misconception that incontinence is an inevitable and untreatable part of aging, leading many to suffer in silence rather than seeking help. This sense of hopelessness can be just as damaging as the physical discomfort, fostering a belief that dignity is slowly slipping away. Addressing urinary incontinence head-on is perhaps the most impactful step in eliminating urine odor permanently and reclaiming a sense of freedom and confidence. The good news is that incontinence in many cases is treatable or at least manageable, contrary to popular belief. The first and most critical step is to consult a healthcare professional. This could be your primary care physician, a urologist, or a gynecologist specializing in pelvic floor health. They can accurately diagnose the type of incontinence, e.g., stress, urge, overflow, and recommend the most appropriate course of action. This might involve simple, yet highly effective, lifestyle modifications. For instance, bladder training, which involves gradually increasing the time between bathroom visits, can significantly improve bladder control. Pelvic floor exercises, commonly known as Kegel exercises, are incredibly powerful in strengthening the muscles that support the bladder and urethra, reducing leakage. A physical therapist specializing in pelvic health can provide personalized guidance on these exercises to ensure they are performed correctly for maximum benefit. Beyond exercises, dietary adjustments can play a role. Avoiding bladder irritants like caffeine, alcohol, artificial sweeteners, and acidic foods can reduce urgency and frequency. Ensuring adequate, but not excessive, fluid intake is also crucial, as highly concentrated urine can be more irritating to the bladder and have a stronger odor. For some individuals, medication can be prescribed to relax the bladder muscles or improve sphincter function. In more severe cases, minimally invasive procedures or surgical interventions may be recommended to provide lasting relief. Think about the liberation this could bring. Imagine being able to enjoy social outings without constant worry or fear. Furthermore, the use of high-quality, absorbent incontinence products, such as pads or specialized underwear, designed for discretion and odor control, can offer immediate relief and confidence while pursuing long-term solutions. Regularly changing these products and proper disposal are fundamental to preventing lingering odors in the environment and on clothing. This comprehensive approach, combining medical intervention with lifestyle changes and supportive products, empowers individuals to regain control and significantly improve their quality of life, effectively removing the primary source of the perceived urine smell. Pain point/problem. Even for those who don't experience significant incontinence, neglecting proper hygiene practices immediately following urination can be a subtle yet persistent source of lingering urine odor. This isn't a matter of overall cleanliness, but rather a specific oversight in the crucial moments after using the restroom. For various reasons, including reduced dexterity, limited flexibility, or simply a long-ingrained habit, some older individuals might not adequately clean themselves after urinating. This can leave small residual amounts of urine on the skin or clothing, which, over time and with bacterial action, can develop an ammonia-like smell. It's a very common issue, often overlooked, and can contribute significantly to the overall perception of an old person smell, even when incontinence is not the primary concern. The insidious nature of this problem lies in its subtle accumulation. A little bit of residue after each bathroom visit can, by the end of the day, create a noticeable odor that causes self-consciousness and can impact social interactions. Perhaps you've noticed this in yourself or someone you care about, a faint, persistent scent that seems to defy explanation. It's a reality many of us face, sometimes without even realizing the cause. The solution to this particular challenge is rooted in establishing and consistently practicing meticulous hygiene immediately after urination. This requires a conscious effort to ensure that all residual urine is removed from the skin, particularly in the perineal area. For women, wiping from front to back thoroughly with toilet paper is crucial, and it may be beneficial to use more than one wipe to ensure complete cleanliness. For men, ensuring that the urethra is completely drained and any drips are wiped away is equally important. Think about how this might apply to your own life. A few extra seconds of attention can make a world of difference. Beyond dry toilet paper, incorporating moist wipes designed for sensitive skin can be incredibly effective. These wipes offer a more thorough cleansing action and can help to neutralize odors. However, it's important to choose alcohol-free and fragrance-free wipes to prevent skin irritation, particularly in delicate areas. For individuals with reduced mobility or dexterity, assisted devices can be immensely helpful. Long-handled personal hygiene aids can make it easier to reach and clean properly. Installing a bidet or a bidet attachment on a toilet can also be a game-changer, providing a gentle and effective stream of water for thorough cleansing without requiring extensive physical effort. Bidet use can significantly reduce residual urine and improve overall freshness. After using a bidet, gently pat the area dry with a clean towel or toilet paper to prevent moisture buildup, which can also contribute to odor and skin irritation. Regularly changing underwear, especially if there's any perceived dampness, is also a simple yet powerful habit. Choosing breathable fabrics like cotton for underwear can help to maintain a drier environment and reduce bacterial growth. Imagine the difference this could make, stepping out with complete confidence, knowing you've addressed every detail of your personal freshness. This proactive approach to post-urination hygiene is a cornerstone of preventing and permanently removing urine odor, contributing significantly to overall comfort and dignity. Pain point/problem. A common, yet often overlooked, mistake that perpetuates the perception of a urine smell is infrequent or inadequate laundering of clothing, bedding, and even furniture covers. Even small, imperceptible traces of urine, either from incontinence or residual post-urination dampness, can accumulate in fabrics over time. These minuscule amounts of urine, when exposed to air and bacteria, break down and release ammonia, creating a persistent and pervasive odor that can permeate a living space and cling to a person. The problem is compounded by the fact that individuals may become nose blind to their own environment, making it difficult to detect the accumulating scent. This can lead to a cycle where the odor is always present, emanating from clothes, sheets, chairs, and even the air itself, creating a constant source of embarrassment and contributing to the stereotype. Think about the subtle yet powerful impact a lingering scent can have on how others perceive you. It's more than just a cleanliness issue. It's about comfort and social ease. Perhaps you've felt this too, a vague sense of something not quite right, even if you couldn't pinpoint it. To permanently combat this issue, a rigorous and consistent laundering routine is absolutely essential. This goes beyond simply washing clothes when they visibly appear dirty. Any clothing, especially underwear and lower garments, that may have come into contact with even the slightest amount of urine should be washed immediately. It's a simple truth, isn't it? For particularly soiled items, a pre-soak in an enzyme-based cleaner specifically designed to break down organic matter, like urine, can be incredibly effective. These cleaners work by targeting the uric acid crystals and other compounds that contribute to the odor, rather than just masking them. When washing, use a high-quality laundry detergent and consider adding a cup of white vinegar to the wash cycle. Vinegar is a natural deodorizer and can help to neutralize ammonia odors. Alternatively, a cup of baking soda can be added to the wash for similar odor-absorbing benefits. It's crucial to use the hottest water setting appropriate for the fabric to ensure thorough cleaning and sterilization. Drying clothes completely is equally important, as dampness can encourage bacterial growth and a musty smell. For bedding, a frequent washing schedule is paramount. Sheets, pillowcases, and mattress protectors should be changed and washed at least once a week, and more frequently if there are any issues with incontinence. Consider how this might apply to your own life. A few changes in routine can yield significant benefits. For furniture, particularly upholstered chairs or couches that may have been exposed to urine, specialized upholstery cleaners designed for pet or urine odors can be used. These often contain enzymes to break down the odor-causing compounds. Regular airing of rooms, opening windows to allow for fresh air circulation, also helps to dissipate any lingering odors from the environment itself. By ensuring that all fabrics and surfaces that might come into contact with urine are cleaned rigorously and regularly, you can effectively eliminate a major source of perceived odor, creating a fresher and more inviting living environment, and enhancing your sense of self-assurance. Doesn't that resonate with you? Pain point/problem. Beyond personal hygiene and clothing, the immediate living environment plays a significant role in how a person's scent is perceived. Ignoring general home cleanliness, particularly in bathrooms and areas where urine might accidentally come into contact with surfaces, can contribute heavily to a pervasive urine odor. Over time, even minuscule splatters on floors, toilet seats, or walls can accumulate and become a source of ammonia smell. Additionally, soiled incontinence products left in open waste bins or even improperly sealed bins can release strong odors that permeate the air. This isn't just about appearances. A stale, urine-laden atmosphere can diminish one's comfort and quality of life, making the home feel less inviting and contributing to a general sense of unease. Think about how a clean, fresh environment elevates your mood and energy. Conversely, a stale one can drag you down. This constant exposure to the odor can also desensitize individuals to it, making it harder for them to detect the problem, while visitors immediately notice. It's a reality many of us face, sometimes without even realizing the true impact of our immediate surroundings. Creating and maintaining a fresh, odor-free living environment is a crucial step in permanently removing urine smell. This requires a systematic approach to cleaning and odor management within the home. First and foremost, the bathroom should be cleaned thoroughly and regularly. This means daily wiping down the toilet seat and rim, and at least weekly scrubbing of the toilet bowl, floor around the toilet, and any adjacent walls that might have been splashed. Use an appropriate disinfectant cleaner that also has odor-neutralizing properties. Consider how this might apply to your own life. Consistent effort leads to lasting results. For waste disposal, the immediate and proper disposal of soiled incontinence products is paramount. They should be placed in sealed, odor-proof bags before being put into a lidded waste bin. Ideally, waste bins should be emptied daily, or even more frequently if there are multiple soiled items. Using bins with activated charcoal filters can also help to absorb odors. Regular mopping of hard floors, especially in bathrooms and frequently trafficked areas, with an enzymatic cleaner designed for pet or human waste, can break down residual urine molecules on the surface, preventing odor buildup. For carpets or rugs that may have been contaminated, a professional carpet cleaning service or a specialized enzymatic carpet cleaner can be used. These cleaners don't just mask the smell, they chemically alter the odor-causing compounds, rendering them inert. Furthermore, proper ventilation is key. Opening windows daily, even for a short period, allows fresh air to circulate and flushes out stale, odor-laden air. Using exhaust fans in bathrooms during and after use helps to remove moisture and airborne particles that contribute to odors. Air purifiers with activated carbon filters can also be effective in continuously removing airborne odors. Regular dusting and vacuuming throughout the home also contribute to overall air quality, preventing dust particles from absorbing and holding odors. Imagine the difference this could make: a home that feels clean, fresh, and welcoming, reflecting a sense of peace and dignity. Doesn't that resonate with you? By implementing these systematic cleaning and ventilation practices, you can create a permanently fresh environment that eliminates a significant source of perceived urine odor, contributing to your overall well-being and confidence. Pain point/problem. While less commonly discussed, certain dietary choices and inadequate hydration can significantly influence the odor of urine, subtly contributing to the overall scent profile of an individual. Foods with strong odors, like asparagus, garlic, and certain spices, contain volatile compounds that can be excreted through urine, giving it a more pungent smell. Similarly, a diet rich in highly processed foods or artificial ingredients can sometimes impact body chemistry and subsequently odor. More critically, insufficient hydration leads to highly concentrated urine. When urine is concentrated, it contains a higher proportion of waste products and ammonia, resulting in a stronger, more noticeable odor. This isn't just about being thirsty. Chronic mild dehydration can be a silent issue, making urine more potent and increasing the likelihood of a persistent smell, even with good hygiene. Perhaps you felt this too, a subtle shift in your body's natural scent that you couldn't quite explain. It's a reality many of us face, often without connecting it to our daily intake. Optimizing dietary choices and ensuring adequate hydration are powerful, yet often underestimated strategies for permanently reducing urine odor. The simplest and most impactful step is to increase daily water intake. Aim for at least 8 glasses of water throughout the day, unless medically advised otherwise due to conditions like congestive heart failure or kidney disease. Sufficient hydration dilutes urine, making it less concentrated and significantly reducing its odor. Think about how this might apply to your own life. A conscious effort to sip water regularly can yield remarkable benefits. Water is the best choice, but herbal teas, diluted fruit juices without added sugar, and water-rich fruits and vegetables like cucumber, watermelon, and oranges also contribute to hydration. In terms of diet, while you don't necessarily need to eliminate all odor-producing foods, being mindful of their impact can be helpful. If you notice a particular food consistently intensifies urine odor, consider reducing your intake or consuming it in moderation. Focus on a balanced diet rich in whole, unprocessed foods, fruits, and vegetables. These foods often contain antioxidants and support overall body health, which can positively impact body chemistry and natural scent. Avoiding excessive consumption of artificial sweeteners, which can sometimes alter urine composition, might also be beneficial. Furthermore, maintaining a healthy gut microbiome through probiotic-rich foods like yogurt, kefir, and fermented vegetables, or probiotic supplements, can also indirectly support overall body detoxification and reduce the burden on the urinary system, potentially leading to less odorous urine. Regular physical activity, even moderate walks, can improve circulation and overall metabolic function, contributing to better waste elimination. Imagine the difference this could make, feeling lighter, fresher, and more in tune with your body. Doesn't that resonate with you? By proactively adjusting your hydration and dietary habits, you can influence the very composition of your urine, making it less pungent and thereby significantly contributing to the permanent removal of a perceived urine smell. It's a simple truth, isn't it? Pain point/problem. One of the most critical, yet often neglected, aspects contributing to persistent urine odor and the general old person smell is the lack of regular medical checkups and the tendency to ignore or delay addressing underlying health conditions. A noticeable change in body odor, particularly a strong urine smell, can be a symptom of various medical issues that go beyond simple incontinence or hygiene. Conditions such as urinary tract infections, UTIs, kidney problems, diabetes, leading to sweet-smelling urine or increased urination, liver disease, or even certain metabolic disorders can all alter body chemistry and lead to distinct odors. Ignoring these potential underlying causes means that the odor is merely a symptom of a larger, unaddressed health concern. This can lead to a cycle of masking the smell without ever getting to the root of the problem, potentially allowing a serious medical condition to worsen. The fear of diagnosis, or simply the belief that such smells are just part of getting old, can prevent individuals from seeking the necessary medical attention. Perhaps you've felt this too, a nagging feeling that something deeper might be at play, but you've put off investigating it. It's a reality many of us face, often to our detriment. Regular medical checkups and a proactive approach to addressing any new or persistent health concerns are absolutely paramount for identifying and permanently resolving odors related to underlying medical conditions. This isn't just about managing symptoms. It's about safeguarding your overall health and well-being. Schedule annual physicals with your primary care physician, and don't hesitate to mention any changes in body odor, particularly if it's new, strong, or persistent. Be specific about the type of odor and when you notice it. Your doctor can conduct various tests, such as urine tests, urinalysis, to check for UTIs, kidney function, or glucose levels for diabetes. Blood tests can provide insights into kidney and liver function and reveal other metabolic imbalances. If a UTI is suspected, a course of antibiotics can typically resolve the infection and, consequently, the associated odor. For diabetes, proper management of blood sugar levels through diet, exercise, and medication can normalize urine odor. Kidney or liver issues require specialized medical treatment, which, once addressed, can significantly improve the body's detoxification processes and reduce odors. Think about the peace of mind this could bring, knowing that you've addressed the root cause of the issue, rather than simply trying to cover it up. Furthermore, review your current medications with your doctor regularly, as some drugs can affect body odor as a side effect. They might be able to suggest alternatives or dosage adjustments. Imagine the difference this could make, not only eliminating an unwanted odor, but also improving your overall health and vitality. By maintaining an open dialogue with your healthcare provider and actively participating in your health management, you can uncover and treat the underlying causes of persistent odors, leading to a truly permanent solution and a healthier, more confident you. Doesn't that resonate with you? It's a simple truth, isn't it? As we've explored today, the notion of old people smell, and specifically, the concern about urine odor isn't just a challenge. It's an invitation to cultivate resilience, embrace new possibilities, and truly live life to its fullest with confidence and dignity. By understanding the true origins of these odors, addressing urinary incontinence, refining personal hygiene practices, ensuring meticulous home cleanliness, optimizing dietary and hydration habits, and crucially, by proactively seeking medical attention for underlying health conditions, we empower ourselves to navigate the later stages of life with confidence and joy. These aren't inevitable declines, but rather areas where intentional effort and informed choices can lead to profound and lasting positive change. If this discussion resonated with you, and you're ready to embrace aging as an adventure rather than an endpoint, then please take a moment to subscribe to Aging Gracefully 60. Your support helps us continue creating valuable content designed specifically for you. Hit that like button if you found this video helpful, and share it with anyone you know who could benefit from these insights. And as always, remember to leave your thoughts and experiences in the comments below. Your perspective enriches our entire community. Together, we can redefine what it means to age gracefully.